Good afternoon, everyone, and I want to welcome everyone to a special RPS Live that is for our staff. We are going to continue to talk about our fall reopening plans and what we're going to do to keep all staff safe, our students, our families, and community. As you may recall, we hosted a series of sessions over the summer in May and June, so we could engage with our students, our families, and staff in different regions. We wanted to share the latest updates we were receiving on COVID-19. We know there were tons of questions from staff, so we really see this as a continuation of these conversations. We know how important it is to have information, but also to have our medical professionals available to you to answer any questions, along with our leadership. So you'll hear from all of them this afternoon. Our moderator this afternoon is none other than Ashley Bland. She was our RPS 2021 Teacher of the Year. Yes, you can come off mute and yell, or I can. Thank you. Woo! So Ashley, we are so happy to have you. It's really important for us. We know students are at the center, but we are just, again, so grateful to everything all of our staff have done and will continue to do as we get ready for reopening. It makes us, just so inspired that we can have staff lead these conversations as well. So Ashley, we thank you, and thank you for leading us today, and I'll turn it over to you.
Thank you so much, Dr. Harris. Thanks for the opportunity to host again. I feel like it's now a common thing. It's like I was a talk show host in another lifetime. So thanks again for the opportunity. So during this evening's conversation, you're going to hear all about our reopening plans, some more information from our leadership, from Superintendent Cameras, and you'll have an opportunity to hear from some guests that we have on the call today, Dr. Tiffany Kimbrough and Dr. Elizabeth Prom-Wormley, and they're going to share some key health and safety information around reopening schools. From there, we're going to kick it back to you all to answer any questions that you have. Superintendent Cameras and the chiefs on the call will answer those questions. So before we dive into the call, I would like to give Dr. Kimbrough and Dr. Prom-Wormley a chance to introduce themselves.
Dr. Kimbrough, can you start for us?
Sure. I'm Dr. Tiffany Kimbrough. I'm a general pediatrician here in Richmond at the Children's Hospital of Richmond at VCU.
Hi, Elizabeth Prom-Wormley. I'm an assistant professor at VCU in the Department of Family Medicine and Population Health, Division of Epidemiology. I am a genetic epidemiologist by training, and I'm currently doing a COVID-19 needs assessment survey out in the Richmond area.
Well, we are so happy to have you on this evening's call, and we're happy to have all of you as well. So know that we have people joining all types of ways today. So either you're joining us by phone, on the Zoom call itself, or you might be live streaming from YouTube. Any way that you're joining, we want to make sure that your voice is heard and that your questions are answered. So if you're joining us on the Zoom call today, we have two ways that you can ask questions. There's a Q&A feature that you can use, and there's also a raise hand feature. And we'll go into that a little more when we get to that portion of tonight's segment. If you're joining us from the YouTube stream, you can also drop some comments in the chat, and our team from the Office of Engagement will make sure that we get those questions in the Q&A so that we can answer those for you. So I am going to turn it over to the man himself, to Superintendent Cameras, so he can introduce anybody else on the call, any important members, and then we're going to get right into reopening updates. Superintendent Cameras.
Thank you so much, Mrs. Bland. It's so great to see you as always. I'm thrilled that we are joined by our Chief Operating Officer, Alana Gonzalez. Alana, you want to say hello?
The trickiness of unmuting. Hi, everyone. So glad to be here and answer any questions that you may have.
Thank you, Alana, and our Chief of Staff, Michelle Udasco, who is our point person on COVID protocols.
Hey everyone, nice to chat this afternoon. Excited to kick off our new school year next week with you.
And we have Matthew Stanley, Director of Advocacy and Outreach, helping out as well. Good to see you, Matthew.
Hey everyone. Again, please leave your questions in the chat and we'll make sure they get shared with our panelists.
And if any board members join or are watching, I would love to recognize them. So let us know and we will be happy to do that. And with that, I'll throw it back to you, Ashley.
Superintendent Cameras, do you want to give us some reopening updates?
Absolutely. Is this the point at which I do the COVID presentation? It is. Okay. Thank you so much. Matthew, can you share the presentation? Yes, fantastic. So we have organized our COVID prevention around the 9 mitigation strategies that the Virginia Department of Health has identified. You see all 9 there, and I'm going to go through each one. Before I do so, I want to just sort of paint a picture. There's no single strategy on its own that can keep everyone safe. It's really about putting all of these strategies together in a school setting or in other settings. Obviously, some are more powerful than others, such as vaccination, but the idea here is that we layer these strategies on top of one another. So even if one is at times not as strong as it should be, it's the combined effect of all 9 together that really makes a difference. So with that, let's dive in. The first mitigation strategy is vaccination. Of course, we know the vaccine has proven to be very safe and very effective. Here in the United States, over 370 million doses have been administered alone, just here in the United States, and worldwide, billions of doses. And we know from the data that it has proven to be a very effective and very safe vaccine. Here at RPS, we have mandated the vaccine for all staff and any partners or anybody who works or visits our schools. I do know that the vaccine is a personal matter, but I do feel strongly that we have a collective obligation to ensure that we are protecting our children and our staff, particularly our elementary age children who are not eligible for the vaccine yet. And as our physicians will likely talk about, one of the best ways to keep them safe is to, in essence, surround them by a cocoon of vaccinated people. And doing that at school and doing that at home as well is very critical. I do want to make an appeal to anyone watching today who is not yet vaccinated. Certainly on the staff front, you have until October 1st to be fully vaccinated. But if there's any family members or community members who happen to be watching, I do want to encourage you to take that step. If not for yourself, then for your loved ones and for RPS, so that we can keep our doors open for our children this fall. All right, let's go to the next strategy, which is the consistent and correct use of masks. You'll see I'm wearing my masks right now. I'm at my office here at City Hall. If you are at an RPS facility, a school, an office, whatever it may be, you need to be wearing your mask. That's true for kids and adults. And what's really important is that you wear your mask correctly. So it has to go over your nose, your mouth, your chin. If you have a mask with a metal insert, that you press it down so it tightly fits against your nose. It's nice and snug so that the air particles that you are breathing out stay in your face and other air particles don't get in. I do want to note a couple of exceptions. Of course, when kids are eating, they have to take off their masks. So in those situations, we are spacing them at least 6 feet apart, trying to have them all face the same direction so that there isn't face-to-face contact while their masks are off. We are also providing a cloth mask to every student, and we'll have disposable masks at every school for any student or staff member who needs them. We have tens of thousands of masks actually to be prepared for any needs that we have. I also want to note just real quick, we do also have masks that are clear for the use in, for example, early literacy. Sometimes with phonics, you need to see the lips. And so if there's any teachers watching today and you need some of those, please just reach out to me and I'll get you connected to the right people. I met a teacher the other day who was about to buy them on her own. You don't need to do that. We'll get you some of those so that you're all taken care of. All right, number 3 is physical distancing. The first point I want to note here is the VDH is very clear that you want to try to maximize distancing, but anytime you're not able to maximize distancing, that should not be a reason to close school or should not be a reason to not provide instruction. And so it's a balancing act. And what we're doing at RPS, I think, is striking that right balance. So students, we are distancing 3 feet minimum to the extent possible, 3 to 6 feet between students and adults, and 6 feet between adults. Again, all to the extent we possibly can do. Also, student desks, the guidance articulates needs to be facing in the same direction, again, to prevent face-to-face interaction. We have seating charts in all classrooms so that we have a good sense of who was around whom, and a number of other procedures in place related to distancing, including limiting assemblies and use of big communal gatherings. I know some of those things are really fun and part of the life of coming back to school, but for now we have to limit those things. The key is to, again, keep the distancing to the extent possible. All right, number 4 is testing, and we are working with the Virginia Department of Health to launch a testing program this fall. In fact, I was on a call about it earlier today, and so looking forward to having those details for you very soon. Number 5 is HVAC and air quality. We know that cleaning the air is also a very helpful strategy to remove virus from the air. And towards that end, we have invested a great deal of money in upgrading our HVAC systems. I want to be clear, we don't have entirely new HVAC systems in every single school. That would be far more expensive than we can afford and would take many years to accomplish. But we have made upgrades, upgraded the filters in the systems, fixed things that needed to be fixed. Of course, many of our systems are still quite old, and so there will be times when there are failures and we need to jump in and fix them, and we will do that expeditiously. On top of that, though, we have installed these hospital-grade air scrubbers in every classroom and every common area, office area. I hope you are seeing them all in classrooms and in offices. If you have a classroom and you don't have one of your air scrubbers, again, reach out to me and I will make sure that that gets taken care of. We also have air filters on our buses and aiming to have at least one window open in classrooms that have windows that are designed to open. As you know, some of our newer schools are not designed to have windows open, given their newer HVAC systems. All right, number 6 is hand washing and hand sanitizing, a simple but very powerful mitigation strategy. I hope you are seeing the hand sanitizer stations that have been installed all across our schools, all classrooms, common areas. I hope you've had a chance to take a look at some of the bathrooms as well, where the team has done just incredible work over the last several months, facilities and custodians, fixing items, painting, and also installing touchless paper towel dispensers, touchless soap dispensers, making sure all the sinks are working. A Herculean effort, but incredibly grateful for that. And a big shout out to our custodians who will be cleaning and restocking bathrooms every 90 minutes during the school day. I also just want to note that we're emphasizing hand washing, hand cleaning before and after meals throughout the day, of course, but particularly at those times as well. Number 7, cleaning and maintaining healthy facilities. We know from the research and from CDC that the risk of transmission from surfaces is actually quite low. And the best way to prevent infection from a surface is actually just to keep cleaning your hands, which is why, again, we have the hand sanitizer stations and upgraded the bathrooms and so on. That being said, we, of course, want to make sure our surfaces are free of COVID-19 to the best that we can, which is why we are disinfecting our surfaces throughout the day. Custodians will be disinfecting high-touch surfaces every 90 minutes, lunch tables, of course, after each use, classroom tables and desks every day, and restrooms every day, in addition to the lighter cleaning throughout the day. I do want to note all of the disinfecting products are medical grade and meet the standards for use against COVID-19. Also, you might see that there are wipes and disinfectant spray available to teachers and staff. I want to be clear, there is not a directive for you to use them to clean. Custodians will be cleaning. We just wanted to make these available for anyone who felt it necessary to do anything additional. We didn't want you to have to pay for any of these things out of your own funds, and so that's why they were provided. Number 8, daily symptom checking. We're asking, of course, everybody, whether you are a family and checking your children before they go to school or a staff member, to check your symptoms. The rule this year is if you don't feel well, stay home. I know sometimes as staff members, we just kind of power through it. We want to make sure that we're there for students, and we are grateful to you for that. But this year is a little bit different. If you are coughing, if you have a fever, if you have other signs potentially of COVID-19, and you can check the symptom checker there. The directive is stay home. It will be excused for students and for staff. And when you do come to school, you'll see that you're signing in with the Raptor system, answering the symptom checking questions. We've also prepared PPE bags that have thermometers and this magnet symptom checker for all of our students, so that they can keep tabs on their symptoms with their family at home every day. And finally, number 9 is contact tracing. We know that despite all of our best efforts, there will be positive cases. We have seen that in summer school. We've seen it in other divisions that have already started. There is no way to limit infection. There's no way to get it down to 0. It's just not scientifically possible. And so when there is an infection, we will quickly engage our contact tracing protocol. And basically contact tracing is figuring out who was in close contact. And the Department of Health defines close contact as 6 feet, within 6 feet, for a total of 15 minutes or more within 24 hours to determine if they need to then be quarantined. I will note that individuals who are vaccinated and are not symptomatic, even if you were in close contact, you do not need to quarantine, which is another reason to get vaccinated, including our students. The more vaccinated, the fewer quarantines that will need to happen. And we'll use that information to then determine who needs to quarantine, and that's why we'll have seating charts. If you've been asked to do that by your administrators, that's why, so that we can quickly identify who was next to whom. Even if you have a subgroup in your class of students that you meet for a particular purpose, want to make sure we have seating charts even for that as well. The better we can contact trace, the fewer people we need to quarantine, and we can keep more kids in school. Of course, if there are a significant number of positive cases or outbreaks, and the Department of Health defines an outbreak as transmission within school, as opposed to getting infected outside of school, then there might need to be quarantining of whole classes, and if necessary, even a whole school. I hope and pray that we don't get there, but that is certainly something that we will keep a close eye on. All right, that is the overview. I know that was a lot to absorb. I appreciate you sticking with it, and looking forward to answering any and all questions that you have. Before I hand it back to Ashley, I'll just say thank you so much to each and every one of you. I'm sure many of you have been grappling with what this year looks like, not just professionally, but also personally. And I just want you to know that I am incredibly grateful for the work that you have been doing and are doing and will do this year, which will be another very challenging year. But I am confident that the RPS family is truly strong and that we will persevere and come out the other side even stronger as we did last year. And with that, I will hand it back to Ashley.
Thank you, Superintendent Cameras. And with health and safety guidelines constantly changing with this pandemic, it's great to be able to hear directly from medical experts. So we heard a lot about what the division is doing, but now we get a chance to hear from our guests today, who will be answering some questions and giving us a high-level overview about reopening schools. So everything from reopening schools to mass safety to updates on vaccines. So I'm excited to turn it over to Dr. Kimbrough and Dr. Wormley to help talk us through these things. I know that I'm especially curious about this as operating in two realms as a staff member and now mother of an RPS student. So I'm excited to hear from you both. Doctors, I'm going to turn the floor over to you. Dr. Wormley, can you kick us off today?
Yes. Did you want to start with any questions or?
Yeah.
Right into the questions, Ashley.
Yeah, sure. So why is it safe to return in person for learning now?
So I think Superintendent Cameras kind of laid it all out for you in terms of all of the various strategies, and it's an excellent set of strategies. When used together, these multiple strategies can have a very strong likelihood of reducing the risk of becoming infected with COVID-19. If you look at even one by itself, there have been many studies of looking at each one separately. They all do quite well, but then to put them all together in a comprehensive strategy like this is a really fantastic way to reduce the risk of becoming infected. So I think you can feel safe that they've thought through as many plans and even contingency plans should something happen to kind of reduce that risk. So it's a pretty safe situation.
Thank you. And continuing on that, we know that one of our mitigation techniques is mask wearing. It's mandatory in all RPS settings. Why is that so important, and how should a mask be worn?
Yeah, so in terms of mask wearing, the use of masks has been consistently shown through literature to reduce the transmission of COVID-19. So for example, there was a systematic review that was published by The Lancet, which went over 29 different studies. And that consisted of about 10,000 participants. When they looked at the results of that study and just looking at mask wearing, they looked at other strategies as well, but we're going to focus on mask wearing for the moment. The people who did not use masks had a 17.4% chance of becoming infected with COVID-19. The people who did use masks had a 3.1% chance of becoming infected with COVID-19. So you're really reducing your risk of becoming infected. And that difference was statistically significant. So that's kind of a big deal for us that, you know, it's not only different, but it's different in a way that's meaningful to provide health, proper health outcomes and really reduce that risk. So it's been consistent. It's been, looked at over several studies, also looked at this kind of systematic review of several studies at the same time, taking differences over into account. And it's consistent. It's a way to go, and it's a very wonderful way to go when you're using the mask. Now, regarding how to use the mask, we talk about how to use the mask in terms of, yes, you want to make sure that it fits over your nose and your mouth and your chin. And if you've got your metal nose piece, that's certainly a way to go. Now, I'm going to show you something that happens with someone like me because I have a small face and I've got the gills here that come out. And so to the extent that you can even tailor the way that you use the masks, you can. So for someone like me, I might actually tie knots in the corners of the mask. And I'm just going to do one. It's like a cooking show, right? So I would tie the knot and make it all the way to the mask itself. So I have one over here, and it's right up to the mask. The other thing that you'll do is that even when you tie the masks, I'm just going to show you so that you can see. You still have a little bit of pokey stuff out here. So you have air that's flowing in and out from the sides of the mask. So you'll want to tighten those up. You can tighten them up by using some staplers and just staple the sides. And so if you do that, it's nice and tight, and you have a nice tight seal against everything. And what I notice when I use this mask is that, oh, now the air is coming in and out. If you can even see it kind of jumping in and out when I'm talking. That's annoying for the speaker, but I know that I've got a pretty tight seal on my face. So I'm reducing the risk of kind of interacting with the air from around me. So that's a suggestion. If you have the capability, and you also need to jerry rig a situation with a disposable mask, this is a great way to go.
And if I can add real quick, Mrs. Bland, we do have pediatric size masks for students who tend to have, particularly at the elementary level, smaller faces. And so in addition to the incredible cooking show style demonstration that we just received for adults, I do want to note that we do have those masks available as well.
Yeah, I was extremely grateful for those tips, because sometimes those masks get a little loose. So that is extremely helpful. I do want to take a moment, because Superintendent Cameron, you said, since we're on the topic of masks, about the clear mask for students or teachers that would need those. Our Chief of Staff, Michelle Hudasco, said that there's no need to reach out. Your school should have an allocation. And so check with them first. And then if not, they would provide more to the school. So just a quick update about that since we're on the topic, but we're going to keep the program moving. So Dr. Kimbrough, I'm going to kick it over to you. Let's talk a little bit about the vaccine. That is a requirement for staff too. Why is that important, and who can get the vaccine?
Thanks so much for having me and for that question. As a pediatrician, I can talk about vaccines all day long. It's kind of my bread and butter. But the vaccine is available. As we all saw last week, Pfizer approved full approval for Pfizer for all of those 16 years of age and older. And as a reminder, the Pfizer vaccine is a 2-dose mRNA vaccine. Pfizer is also available for our 12 to 15-year-olds under emergency use authorization, again, as a 2-dose series. The other 2 products that are currently available in the United States are the Moderna and the Johnson & Johnson. So the Moderna is another brand of an mRNA vaccine currently under emergency use authorization for those 18 and up. And then the Johnson is more of a traditional vaccine using adenovirus. It's 1 dose. So those are the products we have right now. There's others that are also in development. And we're all really excited to hopefully be able to decrease that age down to 5 to 11 in the coming months. So for our elementary school kiddos to be able to be eligible to be vaccinated. As Superintendent mentioned, vaccination is a really important tool for us to be able to provide herd immunity, especially for those kids who are unvaccinated, for our immunocompromised staff members and students. We know that the vaccines are incredibly effective at decreasing not only cases, but hospitalizations and death. And we're also seeing that the vaccines are helpful at reducing transmission. So while we've seen cases of breakthrough in the news, breakthrough infections are still quite rare. The vaccines are quite effective at reducing COVID-19 disease. And that also goes a long way to reducing transmission in our community.
Thank you so much for that, Dr. Kimbrough. Continuing with this idea of keeping staff and our students healthy, what can families do, especially around symptom checking?
It's a great question. And we've seen, I think all of us, just more colds this summer as masks have come off and we've relaxed some of our social distancing. So with viruses, it's really hard to tell one from another, and that COVID-19 is no different, but those symptoms that should definitely perk your ears up should be a new sustained cough, shortness of breath, fever, and then loss of taste or smell. Those are our kind of red herrings for COVID. But in kids, it can also look a little bit different. So kids can have headaches, they can have muscle aches, nausea, they can have vomiting or diarrhea, sore throat. So if you're seeing any of these other kind of not as specific signs, you should still perk your ears up. You should still keep your kiddo home and contact their healthcare provider to determine if they need to be seen or if they need a test.
Thank you, Dr. Kimbrough. Dr. Prom Wormley, a big thing in the news now is the Delta variant. Can you talk a little bit about the Delta variant and some mitigation techniques to prevent that, if all possible?
Yeah, so the Delta variant, the reason why it's in the news is because, one, it is now the variant that you see in most of the cases that are being identified now throughout the United States. Part of the reason why the Delta variant is so prevalent in all these cases is because it's a highly transmissible form of COVID-19. It's easier to catch between individuals, and so you don't need nearly as much time, for example, to be near somebody or distance. So it is just a more transmissible version of COVID-19. And so ways to deal with it are the exact same, the same tools in your toolkit that you've got already are the same tools that you're going to use for Delta. And every single variant that comes forward to this point that we know of, things can change, of course, but that we know of, this same toolkit will be robust for future variants to come. So, the mask wearing, the hand washing, and the consistency of these behaviors, consistent use of these behaviors over time is what's clutch in this situation. The other thing that I forgot to point out in terms of the safety aspect is this use of the air filters. Of course, in an ideal universe, we would be outside all the time because it reduces the amount of concentration in the air of the virus particles. But the reality is we can't be outside all the time to have classes or to be with one another. And so when we have these air filtration systems, it allows the air to move quickly and reduce the concentration of the virus in a classroom so that you can get closer to that situation of outdoors. So what you're doing now is what you need to be doing going forward.
That's good news, and that's great to know. Doctors, do you have any other important tips to help keep us safe as we return to school?
I think another important thing is to think about what activities you're doing outside of school as we see cases in the community on the rise, trying to make sure that you're following these same infection control measures, not only inside of school, but outside of school as well, because our behaviors do impact our neighbors. They do impact our schoolmates, our teachers, our staff. So just trying to make sure that we're all making informed choices into the fall.
Dr. Prom Wormley, do you have anything else to add?
Yeah, I think, I kind of mentioned it, being consistent is the key here, and not just in the school setting, but outside of the school setting is important. So, when we're going out to play dates or to soccer practices or to the grocery store, using those masks, continuing the hand washing, these are environments that you cannot fully control. So to the extent that you can control what's in your space and what you have control over, you should do that and maintain that consistency and acknowledge that it's a pain, and let's just embrace it. It's a pain, but everybody's feeling the pain. And to the extent that we can maintain that over and over again, we're all doing this for each other, and we're all able to care for one another in the way that we would want to care for ourselves.
I love that idea of us being in this together to help fight the spread of this virus. So thank you so much to both of you for your time and expertise in answering those questions. And I know that as staff members, we have questions of our own. So we are going to turn it over to the Q&A sort of segment. So again, multiple ways that you might be joining us today. If you're joining us on YouTube, feel free to drop the question in the chat. Our Office of Engagement is working to make sure that our panelists have access to those questions. But I am going to kick it off with a question from the Q&A section. So Sydney Butterworth would like to know, is there a way that all related service providers get a mask with clear inserts to service students with IEPs? I think we sort of answered this question already, but
the answer is yes. So not only do all of our schools have allocations of clear masks there, we have been working with our speech and language pathologists and other related service providers actually all summer. And everyone also will have availability to access clear masks there. So absolutely. We know the importance for students who may have hearing impairments, as well as using it in early grades for phonics.
Thank you for answering that question. And continuing with this idea of related services, so thanks to our related service providers who are on the call, what recommendations do you have? The doctors may be able to take this one for those providers who may not be able to stay 3 to 6 feet away from their students. They may have to be a little closer because they're teaching different skills. Do you have any recommendations for those staff members?
I think the big thing is the layered approach. So there will be times where we have to break that. You know, I have similar in my daily life that we're within that 3 feet boundaries, we're providing care. But the good news is if you're otherwise following these infection control measures, they're highly effective.
Yeah, I would have to agree. I know there are situations where, you know, particularly for speech issues that you cannot use the mask, but if you can use the mask when you're close to somebody, or for example, if you're able to move outdoors, because maybe in an occupational therapy setting, you might be able to use some of those outdoor tools or things that are happening in the outdoor setting to open up you know, some of those spaces, that may be an opportunity. But I've also had to deal with this myself when I'm doing data collection. In fact, I saw Superintendent Cameras one time when I was doing data collection, and we were using masks the entire time, and we were hot outside. But we needed to use the mask because we have to be close to the people that we're speaking with, and we wanted to keep them safe. So for us in our setting, mask use was really helpful and has been useful.
Thank you for that. We have another question from the chat. Will teachers be notified if any student in their room tests positive for the virus? Teachers have to be near every student in the classroom, so this is a concern.
Yes, so when we receive notification of a positive case, in collaboration with the Virginia Department of Health, we begin notifications and contact tracing. And you're exactly right. In most instances, the teacher will be circulating throughout the room and will likely have been within 6 feet of the student multiple times throughout the class period or the day. However, again, that will be determined by interview and with VDH. The important piece, though, again, is what Jason shared at the beginning, and that is if an adult is vaccinated and not showing any symptoms, even if there had been that exposure throughout the day, they do not need to quarantine. But and to add on one last thing, even in addition to that particular teacher being notified of a positive case, the entire school community will be notified that there was a positive case within the building. For student privacy, we wouldn't indicate the specific classroom at that time, but everyone would be notified that there had been a positive case in the building so that they could continue to watch for symptoms just in case.
Thank you. We got a question from YouTube. Do students need to face the same direction when eating in the cafeteria?
While our guidance certainly encourages folks facing in the same direction as just one of the additional layers, there are instances where that's not going to be possible. However, in the case of meals, that is why we're especially vigilant to maintain 6 feet of distance, because students also will have the mask off. But think of it more as the cafeteria tables as sort of diagonal here, probably here and here, like a triangle, so that the 6 feet can be maintained. So they're not really probably going to be across from someone either, because the tables themselves aren't necessarily 6 feet wide. So we'll be getting the 6 feet at an angle. So that will provide additional protections.
Dr. Wormley, can you say a little bit more? We've gotten a lot of questions from staff who are just very distrustful of the medical profession, especially given its legacy as it relates to communities of color, specifically the Black community, in terms of whether it's different experiments that have been done. And that distrust is really real. I know even for me, as I was thinking about, do I get it with my 10-month-old? It was just such a robust conversation amongst my family. We decided it was the best thing for us. But can you just talk a little bit about, like, that's a real thing for a lot of people, and just would love to hear your kind of take on it and how we should think about that.
Yeah, and okay, so Lord, how much time do I have? Okay, so yeah, let's real talk. The medical community and the scientific community have certainly done a number when it comes to the trust of communities of color. We know that there is a long-standing history when it comes to doing this kind of work, particularly in Black communities here in the United States, and the poor and the uneducated. So the advancements of medicine in many ways are on the backs of these marginalized communities. Nevertheless, there have been these wonderful advancements that have taken place, but the hurt is still there, the wounds are still there, and communities of color are still reticent to participate in research or be part of medicine and be an active part of medicine, whether that be as a patient or, and having honest conversations with medical professionals or with research professionals. And so how that translates into what's happening in the COVID space has been, it's kind of reared its head. We initially saw that with higher rates of cases of COVID in Black and Latino communities, particularly early on. And in terms of the rates of hospitalization, there were lower rates of hospitalization because not so much that they weren't becoming infected, but they didn't want to come in. They didn't feel like they had the money to come in. And as a result, you had higher rates of death and mortality in these communities. So that wound, it's just another example of how that wound is still there. That doesn't mean that we continue to beat ourselves over the head and continue to kind of rip open that wound and say it's there, and we don't do anything about this. No, this is an opportunity, a unique opportunity to be open about what's happened, open about where we've gone wrong, and maybe in some instances try to do better. And so one example of how we've done better as a community of physicians and scientists and community members is the wonderful group of Facts and Faith Fridays that's led by the Massey Cancer Center and the various churches around the Richmond area. That's actually, it came from the churches themselves. And these were really led by Black church leaders, faith leaders, and it's expanded far beyond that area. And so they were saying, we're scared, we're concerned about our clergy at risk, our parishioners and congregants at risk for these diseases, and we don't want to see our people die. What can we do? And how can we redirect this conversation into something that's more productive? And so as a researcher, I acknowledge, a lot of the the history that's come before me. And rather than saying, oh, that was them and this is me, and you're dealing with a different person, I say, that was them and this is me. And I have learned from those mistakes. So in good faith, I'll tell you how I've learned from those mistakes, and I intend to make things better so that I don't make the same mistakes as my predecessors. And a lot of that comes from listening to my community. And I've been doing work, and this is not a plug for the work I do, I'm just a person. But when we were doing our COVID-19 needs assessment survey in the first days, we sat down together and I asked folks, around the table, what are you worried about? What scares you? What do you think you need to know? Because I know what I think I need to know, but it doesn't really matter what I need to know. I need to be responsive to what you need to know and for you to be most successful in this space. And so I just shut up and listened for a good deal of time. And then we put things together and said, what do you think of this? Do you think this is valuable? And what other questions do you have? And certainly in my, my public spaces, when I'm on Facebook or what have you, sometimes I'll just ask, what are the questions that you have? No question is too stupid. Now, don't start combating me. This isn't about the space to have a fight, but genuinely, what are your questions and how can I be helpful in that space? So a lot of it is about listening and taking the time to listen, which I know time is a major commodity these days, but that's what it's going to take for us to break past these barriers that we have long set up and to really heal the wounds going forward. That only took me 5 minutes. I'm glad I didn't go longer.
No, that was good. It was a very loaded question, but I appreciate your honesty and thank you.
So we have some more questions in the chat, but remember, we want this conversation to truly be that. So if you would like to ask your question aloud to the panelists, there is a raise hand feature. And once you're unmuted, you can ask your question aloud. So I do want to remind you of that. So continuing with the questions in the chat while we wait for those of you that want to participate in that way. There's a question about clarifying if vaccinated staff who are exposed to a positive COVID case would need to take a COVID test. And if so, which tests would be acceptable?
Yes, great question. So it is recommended that folks would test at days 3 through 5 after the exposure. And the PCR test is the more reliable and so would be recommended. We also do provide admin leave with pay for individuals to take time to get that test so that they can be assured of their health.
I think a continuation of that question, are they going to be expected to return while they await results?
Yes, but they should always stay home if they're experiencing symptoms.
Thank you so much for that clarification. Do we have anyone that is requesting to ask their question aloud?
We do. The first person that has their hand raised is Luana J. I've allowed you to talk if you'll unmute yourself.
Hi, I'm Luana Jordan over at GH Reed. I had a question. Are the schools going to be providing like the little plexiglass dividers like for the students' desks?
We actually are not. And the reason is in our discussions with the Department of Health, what we learned is they are not very effective and in fact may actually be counterproductive because they prevent the airflow in the classroom. And so that actually could be more problematic. And so on the advice of the Department of Health, we are not providing those.
Okay. Thank you.
Thank you.
And we do have one more person as their hand raised, Kelly Salinas. I've allowed you to talk if you'd like to unmute.
So I'm going back to when, as an employee, oh, what a cute baby. Sorry. Oh, beautiful.
Thank you.
Sorry, that's distracting me. Nice distraction. Oh, goodness. So I'm sorry. so if we're sick, have a bad cough, I'm sadly one of those people who does not stay home when I'm sick. And I probably should. So if you have a bad sore throat or a bad cough and we don't go in, should we go and get tested to make sure that we don't have the virus? And then where do we go? I mean, is there a place like through RPS? Do we just go to patient first? Do we buy our own kits? And that's part of the question. And then Mr. Cameron, you mentioned that that's considered an excused absence if you're staying home. So do we report that differently?
Michelle, do you want to take those? Thank you, Ms. Salinas.
Sure. Yes. And Matthew, perhaps you could put also post the link to the guidance document that's on the website. So the sick leave policy is in a long document with all of our strategies, and it's Appendix D, so that you can clearly see how to take the leave, admin leave with pay. You'll need to provide the documentation of going to get the test to get the admin leave with pay, but that's no problem. And obviously the information is there on how to do so. In terms of if you're not feeling well, when to get the test, and maybe one of the doctors can provide better guidance on this, because I'm thinking without a confirmed exposure, you'd still want to wait a couple of days, given when a positive would show up. Would you guys have the exact date from when you started feeling unwell? Would you say 3-ish days?
Tiffany, you want me to take this one, or you want to take it?
So either way, I'm on more peds. So if you want to take the adult recommendations.
Go ahead.
So we would recommend testing on day 1 or 2 of symptoms so that you get those results and you're able to communicate them to anyone that needs to be aware for contact tracing. So a new cough is definitely a symptom. There was just that case report in the CDC MMWR last week of a teacher who thought she had allergies and came to school and read to her class, and 12 of her 24 students contracted COVID-19. So it's really, really important that even though we all have presenteeism, we all want to show up to our job and do what we love to do and take care of our kids, that we remember just how contagious COVID-19 is, especially the Delta variant.
Yeah, without knowing when you might have a possible exposure for adults, it's about the same. So if you can do it, the day you see symptoms or a day after that you see symptoms, that would be appropriate. We do consider the PCR test to be gold standard because it allows you to quantify the amount of viral DNA or present. And so it's about an acute infection that's happening right now, rather than some of those rapid tests or over-the-counter tests that you might be seeing, which are related to antibodies. So a PCR would be considered a gold standard.
And just to clarify one thing around that, in our partnership with VDH to affirm what the doctor is saying is, we would need either a rapid test or a PCR test to confirm the positive and begin contact tracing. So if you chose to take a home test, that should really just be almost a symptom checker, which is your prompt to take another test, in which case it's not really necessary. You should just move directly to the rapid test or the PCR, and you can get tests for free almost at any CVS's, Walgreens, places around the city. I believe we've been linking to some of those on our website, as well as the RPS directive where you can get tested. As Jason mentioned, we are going to be launching a testing program in our schools, but right now there's plenty of testing sites in the community as well.
Thank you so much for that guidance. So we have another question about mask safety and basically which mask would be the best. So is it better to wear a certain type of mask? Doctors, do you want to take this one?
I saw that one in the question box, and it was between the N95 and the KN95. So the N95 is considered quite, that again, gold standard, medical grade, that's something that you can definitely get when you're in a hospital setting. The caveat to using an N95 is that if everybody and their mother goes out to get an N95, we may not have enough to support our hospital systems, and they're our highest priority individuals. So we don't push N95 masks as a first line of defense, but rather some of the other ones. So a KN95 or a KF95 are considered as good as an N95. It's not, it's not as good, like directly, but it's pretty good. And you shouldn't feel like you're somehow so much worse off because you're using a KN or a KF in comparison to an N95.
Gotcha. Thank you so much for answering that question. So we have a question around air safety. So if you're at a school that does not have AC, or the AC is out for any particular reason, how should those teachers stay safe?
Well, first, if the AC is out, we will do everything we can to very quickly fix that, not just for COVID reasons, but because it's hot and it makes the learning environment extremely difficult. But it's also why we have the hospital grade air scrubbers in every classroom. So in many ways, that is an even better defense than the overall HVAC system, which may actually take longer to recycle the air in a room and get to the filtration unit. These in-room units are cycling the air all the time. And again, these are hospital grade units. And so that is really the first line of air defense. And so those, all they need is just to be plugged in the wall. So there's nothing fancy about making sure they're operational. And so those are available everywhere. And again, if you're in a classroom or an office and you don't have one, please let me know and we will get that taken care of right away.
Thank you. Is there a point, or at what point can staff or a student who's tested positive return back to work or school?
Michelle, you want to take that one?
Sure. It's always important to follow the guidance from the Virginia Department of Health. On average, an isolation is 10 days, and that's if you're the individual who's positive. So positive people are isolated, exposed people are quarantined. And a quarantine is actually a little bit longer, generally 14 days. And that's because of that onset of symptoms or when the exposed person may have been contagious. But VDH will confirm specific dates for return if you were positive or exposed when they speak with you.
Thank you. Is there a recommendation for the location of the in-room air scrubbers? A lot of them are in the corners of the room, but is there a preferred place for them to be?
They can be anywhere in the room. The important thing is that they're on, and I recommend having them at medium. They work just as well as them being on high, but when they're on high, they're very, very loud, so it might be difficult for students to hear you. So wherever they are out of the way and not a danger to students is the best place to have them in the room, but they will work as well any place in the room, and as long as they're on. And also, please don't turn them on or off. They should just stay on, and custodians will manage turning them on and off. We will leave them on during the week and then turn them off for the weekend when there's no one there, and turn them back on very early in the morning on Mondays. So you don't have to worry about turning them on or off.
Thank you for that guidance. So we have another question from YouTube. It was kind of a continuation. I feel like you answered most of this, but is there anybody who's responsible for coding the absences due to COVID? And is there a different code for the sick leave? that would need to be taken?
Yes, in Appendix D of the document, you'll see the contact. Jason's chuckling too. I'm chuckling that we know the appendices by heart, but in Appendix D is Allison Davis's contact information. There is a different code for the admin leave, and you'll just want to reach out to her to be sure she has all of the information.
Thank you. We have a question about sort of a specific case. In the event that a teacher is immunosuppressive and they're within 6 feet of a student who tests positive, do the same rules for quarantine apply for that teacher? And will they be allowed to go into quarantine even if they are vaccinated?
Well, there are different rules for student to student, student to adult, and adult to adult. And so that's why this can sometimes, again, feel confusing. So student to student distancing, if both students are wearing a tightly fitting mask, as the doctor shared earlier in our conversation today, if they're wearing their mask 100% of the time correctly, a close contact between students is under 3 feet. It is that exception of the 3 to 6 feet does not apply between students and adults to adults, which is a 6 feet contact. And so that's when close contact or exposure might look differently. As long as an adult is vaccinated, the quarantine is based on if they're showing symptoms or not. And so that's something that they would want to talk with VDH about when they called them. But again, a vaccinated adult does not, or student, does not need to quarantine unless they are experiencing symptoms.
Ashley, I'll take a couple questions from the Q&A chat. Superintendent Cameras, there is a question around awareness of teachers who may not have a break in their schedule. Just, I think, want some clarity on the expectations of teachers eating lunch in the classroom with students.
Thank you, Dr. Harris, for that question. We do need to be a little bit creative when it comes to lunch for our students, given that we need 6 feet of distancing, and that means that sometimes we can't have all the students in the cafeteria. They may need, in part, to be in the classroom. I do know that that means potentially on the elementary level, that might mean that you have students eating lunch in your room at the same time that you would be eating lunch. And normally that would be a time, of course, that you had to yourself. It is something which I wish we could avoid, but at this moment, in the interest of safety, that may be necessary. If it becomes truly challenging for you, please reach out to me and I will certainly explore with the administration if there is an alternative arrangement. But I do want to extend my true appreciation to each and every one of you. I know that is a challenging situation. Again, this is in the interests of health and safety.
Thank you. And what will be required in terms of quarantine for siblings of exposed students, Michelle?
It's a great question. So a secondary contact of an exposed student does not need to quarantine. So if you have Jane in the classroom who is positive and Michelle is a close contact, then Michelle should quarantine. But Michelle's brother does not need to quarantine. Now, if Michelle became positive from the initial close contact, then Michelle's brother would quarantine. That would be different guidance if the sibling of the positive person. So if Jane's as a brother at home, that could be considered what's called an ongoing exposure, because Jane and her brother are home together every day, likely without masks, and that could be looked at differently. But for an exposed student who's in quarantine, their siblings do not quarantine.
Got it. Thank you. And then what are teacher expectations for teaching virtual online when a classroom needs to quarantine?
If a whole classroom needs to quarantine, then the class would switch over to virtual, and in essence would be much like we experienced last year for the duration of the quarantine. We are grateful that with the federal stimulus funds, we have been able to ensure that we have a Chromebook for every student, hotspots as are necessary. And that is also why we are instructing all teachers to set up their classrooms in Google Classroom, just like we did last year from the first day, even for in-person, and to use them even for in-person assignments and such, so that in the event we do need to go virtual, we can do so seamlessly and kids will not miss any significant amount of time.
I don't see any more questions in the chat, but Matthew, are there any more hands raised before I let Superintendent Cameras have some final remarks, and then Ashley will close us out?
So Shade, we don't have any more hands raised, but Dr. Prom Worley was sharing that she has a link to the needs assessment survey that she'd be interested in sharing with everyone. Dr. Prom Worley, do you want to say a little bit more?
Yeah, thank you so much for the opportunity to talk about this. So I am doing a COVID-19 needs assessment survey. It really is just to know about what are the current behaviors, actions, and needs that folks have at this time. Takes about 15 minutes to complete. I have a link that you can use to take the survey. I'm going to put it in the chat box. If you're willing to do it, we'd love for you to do it. If you don't have the time, we understand, but it helps us out to help know what's going on in our community. We share this information with our community partners so that they can do a better job more broadly. So thank you for your consideration.
Thank you so much. And I just want to thank both doctors, Dr. Wormley, Dr. Kimbrough, for being here and just talking in terms we can understand. We kind of always don't get that. And it was so important to have you here, but it really was a joy to be able to, as we think about reopening, making sure that we have experts and we're getting the best information possible. So again, we want to thank you. And then Superintendent Cameras, I'll turn it over to you.
You would think after 18 months, I've figured out the mute button. Thank you, Dr. Harris. Thanks to the whole RPS team and to the 2 physicians who joined us today. Thank you so much for sharing some of your time and expertise with us. And to everybody watching, thank you all. I know this is not where we anticipated being even just a few weeks ago, and the stress and anxiety is high, both professionally and personally. I ask not only that we give each other grace, but that you give yourself grace. This certainly will be a challenging year, but I do believe, and I don't mean this in any Pollyannish way, that we are a strong community. We are a strong family here at RPS. I think our experience last year showed what we are capable of when we do join together and support one another. And I am confident the same will happen this year, and we will continue to get stronger with each and every adversity that we face. So again, thank you. Give yourself grace, give each other grace. And I look forward to seeing many of you in person when school is back in session on September 8th.
I want to bid you farewell. I also want to thank the chiefs who are on the call today, Michelle Hudasco and Alana Gonzalez, for joining tonight's call. To the doctors, again, Superintendent Cameras, the Office of Engagement led by Dr. Harris. Thanks for giving me this opportunity. Thank you, Matthew Stanley and Tamika Massey and the whole entire team. I always gain a lot from these conversations, having hosted several of them, so going to multiple ones. And so it's wonderful to know that we have this support built within the division. So I want to bid you all a farewell, but I'll see you soon as we reopen with love on September 8th. You all make sure that you have a fabulous rest of your evening and see you soon.
Good night, everybody.